That's exactly right, because in Washington there is still a lot of work to be done on this bill, and what the final outcome is still a bit up in the air. One of the senators who will be voting on this bill tomorrow, who has worked on it over the long period of time, in fact these last 3 weeks of strenuous debate, Senator Debbie Stabenow joins us live now from Washington. Senator, I know you must be pleased that this bill is going to pass in the morning, but this is by no means the end of this debate, is it?
Rick, it's really not, but the most important thing for me is that for the first time we're putting in place a way for people to get affordable insurance and to help small businesses and to strengthen Medicare. And for us in Michigan, it's about saving jobs by cutting costs for employers so that they can keep more people employed. But you're right, it's one step. We have to go, House and Senate come together to bring together different views and then go to the president, and then it's still not the end. There are things in this bill I'd love to see change, I'd love to see strengthened, but it's a foundation. Frankly, just like Medicare, when it first started, it just covered hospital visits, and then it later covered doctor visits and home health, and then later prescription drugs, and later people with disabilities. So this is a foundation.
Well, and isn't that what some of the critics had said, that this is just the beginning? Because once this is passed, assuming that a conference committee report can be agreed on by the House and Senate, then if a public option isn't there now, isn't that something that members of your party on both the House and Senate may well look into later? And isn't this really, according to the way that this is played out, just the first step in what you and some of your colleagues would like to see in a total health care reform?
Well, what I'm looking for is a way to hold insurance companies accountable so that people who have insurance today, which are most of us, get what they're paying for. They don't get dropped when they get sick. They can find insurance if somebody in the family has a pre-existing condition. They aren't charged different rates because a man charged or a woman's charged differently than a man, and so on. That people are treated fairly. That's within this bill. I think the reality is that the Senate bill would be very much a framework for the final bill, even though many of us have different ideas of what we'd like to see. Everybody understands that this bill holds insurance companies accountable. It strengthens Medicare. It provides over 30 million Americans, most of whom work for a small business, a way to get more affordable insurance. So this is very positive. It's an important step. It builds on our private sector employer-based system. And I think it's the right thing to do for us in Michigan right now, where so many people are losing their job and then losing their insurance.
There are a lot of people who would say that the deal that Ben Nelson got for Nebraska would be a good deal for Michigan. And I know a lot of horse trading goes on all the time when bills are being debated and votes are being sought on Capitol Hill. Are the deals cut in this case any different than what happened with other bills, and should people be surprised?
Well, there's always negotiations going on for individual states. There are provisions in this bill around Medicaid that I was able to get in for high unemployment states to be able to get more of a contribution from the federal government. I think some things that were put in here, frankly, need to be looked at, and we need to make sure they're fair for everybody and not just a few. But we all focus on certain things. I've been able to get in this bill help for early retirees, so that insurance companies would have basically the federal government partnering with them to cover early retirees, hopefully, so that businesses will be able to keep them on their insurance longer. And that's something that affects us in Michigan. So there are many, many things that I focused on related to what's happening for us in Michigan, and that is what members of Congress are supposed to do.
Senator, thank you as always for your time. We look forward to you coming back here and sitting down on To the Point. We'll talk about this in detail after the first of the year.
Great.